Hello, this is Dr. Nancy Trimbley with your Healthcare Arsenal podcast. This podcast is designed for that person who knows that there is a better way towards health and wellness. They just don't know what that better way is. And my hope for you is that with each passing episode, you get closer to being your own best expert. Today, I don't have a guest, but I will have a practitioner of this health and healing technique come on the show in the future. What I'm going to share today is my own personal experience. I was turned on to this by one of our recent guests, Dr. Kathy Murphy, who is a holistic orthodontist. And she started to bring up myofunctional therapy. Myofunctional therapy. And with my limited knowledge of it, I'll explain to you that it is the therapy of the jaw, the mouth, the tongue, soft tissues of the mouth, the muscles of the jaw, and the swallow reflex, your breathing, ability to breathe clearly and have a clear airway. And Dr. Kathy Murphy and I were talking off air when we finished our interview, and I became intrigued with this therapy for myself. Not so much because I have or feel like I have difficulty with swallowing or breathing or chewing, but my left ear tends to get clogged, and I have difficulty on airplanes. I probably could scuba dive because of the pressure and the pain it would create. And also sometimes my ear pops and I can hear so much better. So there's something going on with eustachian tube. I'm not sure, but this seemed like an awesome thing to investigate for myself. And you know me, I always love to try things out, like do body hacks on myself to see what happens. So I went to see a local practitioner. Her first name is Stacy. I will include her website with the show notes. She is by education a dental hygienist. And she got into this, and I'll let her tell her own story when she comes on. She got into this years ago, and she spent first of all, on our first in-person appointment, she spent 2.5 hours with me. Prior to that, we did a Zoom call where she explained what she did, and I will try to explain to you a bit about what happened, what she discovered in these 2 sessions, and then my experience thus far. Because after doing what she told me to do for 4 days, my snoring disappeared. And if you have spent any time with me, you know that I have revealed that I have a snoring issue, and I pretty much have many different types of snoring as per my husband, and it has been every single night. So, what she found with me and the 2.5 hours she spent with me in person was lots of photographs of my mouth, my teeth, how my teeth align, and also what happens when I swallow, what happens when I do certain things. And what she found with me was that I do not have my tongue in the correct spot in my mouth. My tongue is actually weak. So think about this for a moment. Just as you're sitting there, sit relaxed and just have a relaxed jaw. Take a deep breath, let that breath out, and notice where your tongue is in your mouth. For me, the tip of my tongue was close to the back of my top front teeth, and it kind of relax almost like a hammock within my mouth. That is not good. What should be is your tongue should almost like a magnet adhere to the roof of your mouth, and that's where it rests. And because my tongue was weak, I was using the clenching of my jaw to swallow, which then in turn caused me to have really tense jaw muscles, which was always kind of perplexing to me. I was getting adjusted, I was having cranial sacral therapy, I would even have jaw work and muscle work done, but those muscles were always super tense. I never really had jaw pain, although there have been times where my jaw could almost slip out of alignment and at times almost get locked there. Very recently, just a month or two ago, I just got back from Greece and I brought some Greek honey candy, which was harder than I thought. Took a bite and my jaw muscle spasmed and stayed clenched for days. It was very uncomfortable. It was hard to chew, hard to even bring my teeth together. So there's an underlying issue there. And you'll notice what happens in the holistic realm of healing, whether it's a chiropractor or an acupuncturist, or in this case, a myofunctional therapist. Though that practitioner is looking at your overall health and function and healing. So back to me for just a moment, and then we'll circle back to that concept. So for me, for years, I've had these tense muscles. When I go to my dentist and he's doing his cursory check of the lymph nodes and, do you have any tongue ulcers or do you have any tumors starting? And when he would check my jaw, I would cheat. I would stick my bottom teeth out, my bottom part of my jaw out, and then open, because when I do that, there's no click in my jaw. But if I had to do that normally without jutting my jaw out, there's a little bit of a click, which in the realm of TMJ syndrome. Now, the TMJ is just another word for our jaw joint. But in TMJ syndrome includes pain, clicking, and the inability to open your jaw 3 knuckles wide, which I can just barely do 3 knuckles wide. I don't have pain. I have this very slight click. So if you were to try to compartmentalize me into a diagnosis, you might say that I have a very mild case of TMJ syndrome. Anyway, so as she's checking me out for this 2.5 hours, and she's got me biting on things, and she's got me eating things, and she's got these cheek retractors in, not a good look, by the way. And she's looking, and she's lining up, and she's measuring, and oh my gosh, it was fascinating. She, like I said, discovered my tongue was weak. I clenched my jaw in order to swallow. And the only reason I can speak and chew halfway normally, is because I am overcompensating for this weak tongue by also raising the soft tissue of my mouth very high. So fascinating. And as a little side point, there are some times where I will choke on water, and I do think it's because I don't swallow normally. This is a way the swallow should take place. It should be from the tongue, where your tongue is at the roof of your mouth. Your tongue, then you bring the water in through the sides of your mouth onto the top of your tongue, and your tongue propulses it down your throat. For me, in order to swallow, I was clenching to push the whatever it is down. Now, here's the bigger issue. Now, she gave me exercises to do. Yes, quite hilariously, tongue strengthening exercises, which she wanted me to do 10 reps 10 times a day. I got to the first set of those. I got to rep 8, and I'm like, damn, my tongue's tired. I can only do 8. Otherwise, I start doing it wrong. And another exercise where I move I put air in my upper lip, also an awesomely attractive look, and moving it around to the cheek, to the bottom lip, and to the other cheek. I won't show it to you as I do it, because I really have to concentrate on this, and I cheat. I move my lower jaw to move the air around. So what she has me doing is keeping my teeth together to try to do this. It is quite a challenge. So I'll do these exercises for 3 weeks every day, and she and I will meet again and see what kind of progress I've made. And so far, like I said, with just doing the tongue exercises for 4 days, my snoring has stopped. It's like a miracle. I didn't even expect that. Now, what it's doing for my ear, I have no idea. And she even said to me, she goes, I don't really know if it's going to help your ear, but I do think we're going to improve some things. And I do think your snoring will go away. And I do think your overall function will improve. The swallow reflex, you wouldn't really think of it so much, but we swallow our own saliva 1,000 times a day. So I am fighting against a muscle memory of my just automatic reflex of swallowing that I have had now for close to 60 years, 1,000 times a day. So I am really trying to concentrate on this. I'm using a straw most often when I sip things. Right now I don't have a straw, but what I also do incorrectly is, and try this if you have a beverage handy with a straw in it, I put my tongue, or I have up until now, put my tongue at the tip of the straw to swallow. And what that does is it makes the tip of my tongue go down. That's what you don't want. So what I need to do is when I use a straw, keep my tongue tip at the top of my mouth, and then let my tongue do the swallow. So the beverage comes around the sides of my teeth and jaw and then goes onto my tongue, and then my tongue helps me with this, or does the swallow. So this has all been super fascinating. And with Stacy, what she does is she sees not only adults like me, she sees babies and small children. So that, because if we can prevent these problems early in life, will help with speech, will help with digestive function. And because the jaw and the mouth and the myofascia of the mouth and jaw are all connected to the cranium and the neck, it has a lot to do with overall health and function. So there is a possibility that for me, this neck tension I tend to carry around with me always, no matter what kind of adjustments, what style, what technique, what kind of massage I get, it's just always there. There's a possibility that as my mouth relaxes, as these jaw muscles relax, that this myofascial connection to my neck will allow those muscles there to relax. Fascinating, right? It all works together. Now, Stacy also sees people who are getting the tongue tie release or cheek tie release, which could be babies. It could also be adults. She's not sure if that's an issue with me or not, because we need to go through this process of first doing these exercises, see what kind of progress I make, see what happens with the floor of my mouth as my tongue gets stronger. It sounds so funny to say that. It's like doing finger exercises, which, yes, that's a thing too. Um, and so we'll see. We'll see. I'll certainly touch back with her. She will do an interview for this Your Healthcare Arsenal podcast when I am done with my treatment. So that'll be fascinating to weave my own experience into her expertise. Now, going back to this concept of this whole body health and holistic viewpoint of a person's healing and health and wellness, um, the dental profession is in very much rooted in the conventional medical model, so that when a dentist sees you, they are looking at your teeth, just your teeth, and they are not asking the bigger question of why. Why is this person having difficulty with this tooth, that tooth? Why is, if you're going to an orthodontist, why are these teeth having a misalignment? Why? They're not thinking about that. And very often, if you are diagnosed with TMJ syndrome, they are a conventional medical model dentist or orthodontist is going to just put a mouth guard in. The mouth guard is a crutch for an underlying problem. And yes, it might help, but it's only addressing a symptom and not solving the underlying issue. And it doesn't matter how much you pay for that mouth guard. If you pay $800 for it, it doesn't matter how well it's made or how much it costs. It is not answering the question of why, which is one of our stealth health questions in the book Stealth Health. Is we want to really sleuth out the why of this. So for me, the fact that my ear plugs up sometimes, I have not uncovered the why of that yet, but I feel like I've uncovered some of the whys as to my TMJ tension and maybe some of the whys of my neck tension. And what's so awesome about this realm that I'm in, where I'm so curious about holistic healthcare providers, is it leaves me open and available to say, I don't know if you can help me, but shoot, let's check me out and see what we find. I have the open mindedness to do that. I have the capacity to pay for it as well. I have money set aside for things like this because I truly believe that the holistic, whole body healing aspect of any diagnosis should be primary, should be first, and then let's look at, the conventional medical model or conventional interventions. Also looking at using medical technology of testing, as long as it doesn't create harm, to give me more information. For instance, Stacy suggested that I do this. It's a CAT scan of your jaw, mouth, and even your throat and neck, because then she can see the underlying anatomy, literally see my tongue, the structure of the roof of my mouth, my throat, where the air and food, how much space there is for that to get through. Is there a possibility that we could make changes with exercises and other things? And my body has the capacity to change and get more air in, get more food down more easily. Or is there a physical limitation to matter? Is there a physical limitation in my body that says, you know what, you are just built with your tongue too big for your mouth? Or you are just built with an airway that's more narrow than most. So we don't have a lot of room to play with. I don't know yet, but she has suggested I get this test, and I probably will because you know me. I'm my own favorite petri dish. Let's take a look, let's discover, and just see. I'm just fascinated by this stuff. So, what my message for you is today with this myofunctional therapy, which, by the way, obviously hard to find because I didn't even know it existed. I've been living in this realm in my county, and I didn't even know this thing existed, and it's right here. Um, so, my message for you is if you have any kind of issue with snoring, sinuses, ear issues, swallowing issues, tongue tie, possible tongue tie, um, anything like that, I would highly suggest you see one of these therapists. And by the way, Stacey also recommends that you incorporate into your healing a cranial sacral therapist, a massage therapist that does the internal jaw work. Side point, I have a YouTube video on how to do trigger point therapy yourself on these internal muscles of the jaw and the external muscles of the jaw. It's easy to do. You can do it within minutes per day. Um, so she also, like me, likes to use these other holistic modalities to the advantage of her patients. That's how we are. That's how the holistic realm is. I want you to be better, whether it's within my four walls or without. We're going to incorporate these other holistic providers to get you the furthest we can on your path of wellness. So I hope that's been as fascinating for you as it has been for me. Of course, I will update you on that. And as always, with each passing episode, I am hoping that you get closer to being your own best expert. Bye for now.